This is the City of Waupaca, first Tuesday of the month, City Council meeting.
All right, it's 6 o'clock, and we have a public hearing first. So I'll call this public hearing to order. In attendance, Sandy, you want to just take roll call, please?
Sure. Brian Smith.
Here.
Steve Hackett.
Come on, here.
Lori Chestnut.
Here.
Paul Hagan.
Here.
Alan Keeland.
Here.
Scott Perchatsky.
Here.
Dave Peterson.
Here.
Paul Mayo.
Here.
Dimitri Martin. No, Dimitri.
Yeah, I don't
see him.
I don't see his
Okay.
initials. Yeah.
Mary Fair.
I don't see Mary's either, to tell you the truth.
And Eric Olson.
Here.
8 present. We have a quorum.
It is 6 o'clock, right?
It is.
All right, awesome. All right, the purpose of the hearing is to discuss the 2021 annual property tax levy and the budget, and I thought this would be a good time for Kathy just to do a summary of where we are, and she has some updated numbers for us too. So, Kathy,
I'm here.
good. It's all yours.
In the packet, I provided a list of the items that just a synopsis again of everything that's included in the 2021 general fund budget. And that, again, we're looking
Kathy,
at...
how come you're sideways? You're laying on your bed?
Yeah, no, I'm in the
Okay.
kitchen. Sorry.
I saw everybody else laughing, and I thought, oh, here we go. So,
well. I'm
sorry
in the
about that.
kitchen.
Go ahead.
We have a 2% increase across the board for all of the employees. We have 50 cents for our cleaning staff. These are our lowest paid employees, and we're trying to raise them up so that we're competitive with what we're paying our contract staff and for cleaning and county. So we're using that as a benchmark for that. Those 6, I believe, 4 employees only. Again, we're looking at going to the state for the long-term disability program, which we do have budgeted in the 2021 budget, but there is a premium holiday, which should net us about $15,000 over the year. What else do I have on there? Pretty much keeping the revenues the same. We had a slight increase in state shared revenues, and going forward, the expenditures, employee costs are pretty much staying the same due to no increase in the health insurance premiums for, I believe this is the 3rd or the 4th year that we have that. And going forward, minimal increase in the protective Wisconsin retirement costs. So it does have the full year of the drug officer in the general fund, and the second PSLO is fully funded this year with the school district. So that's all I have as far as the general fund. The tax levy, when you get to the information, on the levy amounts. I don't know, Aaron, can you pull that up? It's the Excel one.
Let's see.
It'll be it's in the packet with the resolutions.
Yeah, keep going down. Yeah.
Hold on, let me get to, I gotta go way down here for this.
There you go. Well, that's income continuation one. Go
Next
up.
one up.
Here.
Yeah.
There we go.
All right. So our levy is actually increasing with levy limits by 33,710. When you put the TIF increment across the board, our rate is going up, I believe, 36 cents. And the full rate with the school levy credit is going up a total of 70 cents. Our school levy credit did go down this year. So we're looking at a 70-cent increase in the total tax bill with the net tax levy. And then the first dollar credit for those lots that have improvements went down a bit, and so did the lottery credit. Obviously, they're giving away more lottery credits than they are keeping and dividing it across the state. So I think they've had some pretty big winners. So that's probably why the lottery credit's gone down. Otherwise, to reiterate again, we've lost $6.2 million worth of assessed value. So that tax levy, that total net tax levy is distributed across a smaller base. And that's why the rate increase is going up. And however, I did want to put in the fact that our our equalized value did go up by about 7 million. So the state's formula figuring out what market value is based on total sales and that shows that the value of our properties are increasing, and we should really be looking at, since this is our first year under 90% fair market value for assessed, start looking at our assessment and going for a revaluation. So to bring up those values and spread it again, the tax levy over a bigger base. That's all I really have.
Can I ask?
Sure.
May I ask a question?
No, hold on, Dimitri. We're just in the public hearing part of that of the meeting. You certainly can ask questions about the budget, but can we do that within the regular meeting?
Sure.
Thank you. Sorry, I just wanted to make sure we stayed with what we're doing here. So, Kathy, you're done with your spiel here?
Yeah.
Okay.
Yeah.
Thank you.
I haven't. Nothing different than it was the last night, other than the balance of the numbers coming in for the net tax rate.
All right. Thank you, Kathy. That helps a lot to get an overview of what we went through at the last meeting. Aaron and Sandy, you guys are going to have to help me. Have we had anybody that wanted to speak to the council in testimony in favor of this or in opposition to this budget and tax levy?
Brian, I've heard nothing.
I have not either, Mayor.
Okay. So are there any, I mean, obviously, council members, you're going to have the opportunity to speak during the regular session, but is there anybody on city council that wants to speak during the public hearing to give testimony in favor, not to ask questions necessarily, but just to give testimony in favor of the budget or opposition to the budget? All right.
I'd be happy to give testimony in favor.
Okay, that'd be great.
Right now?
Yeah, go ahead.
Yeah, well, I just wanted to comment that after we had a chance to preview this in the prior meeting, I spoke with Aaron, and one question that I wanted to ask, and I didn't think of it at our last meeting was, are we benchmarking ourselves against other communities? And because it's really hard to look at like what we're spending on law enforcement and whether or not that's a realistic sort of number or not without having something to compare to. And I was just wanting to say I was really impressed with what Aaron put together. He has benchmarked us. It's maybe a year old, might be something that it'd be nice to come back to on a regular basis. But it seems like we're comparing very reasonably to other communities, and it seems like a very reasonable budget.
Thank you, Dimitri. Anybody that'd like to give any testimony, either in favor or opposition? Sorry about that. So hearing none, I'll declare this hearing closed at 6:11 p.m. And we'll go right into the regular council agenda. Aaron, Sandy, I am assuming you guys are all set for us to do that.
Yep.
Yeah.
All right. So it is 6:11 p.m. I declare this regular city council meeting to order. It's being done via video teleconferencing. And let's begin with the Pledge of Allegiance. If we could get everybody to rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mayor Smith, I would just like to say that I'm here. I wasn't for the hearing. I had trouble getting on, so here I am.
Thank you, Mary. I think we'll after Sandy reads the open meeting statement, I think we'll have her take roll again for us, because I think we have a couple of new additional people since the public hearing. Yep, absolutely. Thanks for telling us. Sandy, you want to go ahead and read the open meeting statement, please?
Yes, I would. But first of all, I did just learn recently that today is Mary Fair's birthday.
Oh.
And I thought I should mention that. Happy birthday.
Oh, thank you.
You're welcome.
Let's see. Dave
Yes.
Peterson and Dimitri are probably the only two singers we have in this group. So you guys want to sing happy birthday then?
That's okay. Just elbow bumps or something will do.
All right. All right.
Thanks, everybody.
Go ahead, Sandy.
All right. This meeting and all other meetings of the Common Council are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin state statutes, so the citizens may be aware of the time, place, and agenda of this meeting.
All right. And would you take roll again, please, Sandy?
Brian Smith.
Here.
Steve Hackett.
Here.
Lori Chestnut.
Here.
Paul Hagan.
Here.
Alan Keeland.
Here.
Scott Perchatsky.
Here.
Dave Peterson. Here. Paul Mayo.
Here.
Dimitri Martin. Dimitri.
He said in the chat that his screen froze and he'll have to get out and restart.
Okay. Mary Fair.
Here.
And Eric Olson.
Here.
10 present. We have a quorum.
All right. Thank you, Sandy. I also want to recognize some other, the department heads that are in attendance include, of course, Aaron Jensen, our city administrator. You've heard from Sandy, our city clerk, and you've heard from Kathy Kaza, our finance director, treasurer, and you just heard from Peg Burrington watching the chat room for us. Thank you, Peg. Our library director, and Dom Hart, our city attorney, is with us. Justin Behrens, Public Works Director, Andrew Whitman, Parks and Recreation Director, Brian Hosell, Police Chief, and of course we have to have Josh Warner on here, our IT Community Media Director. So thanks, department heads, for sitting on a required meeting. And then also in attendance, we have, I think from the chamber, we have Mitch Swenson. I can see him. And then also I think Terry Scholes is on. I thought I saw Terry earlier. All right, let's go to the consent agenda then. Sandy says there are no changes to the consent agenda, so we can go ahead and, unless somebody wants to see an item moved to the regular agenda, we can go ahead and approve that agenda.
Move to approve, Lori.
Keelan, second.
Motion by Lori Chestnut, second by Alan Keelan, that we approve the consent agenda as printed. Discussion. All in favor signify by saying aye.
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 Against? Motion carried. All right, same thing with the regular agenda. Nothing to be added or deleted or edited. So we'd need a motion to approve.
Olson to approve.
Second, Fair.
Motion by Eric Olson, second by Mary Fair, that we approve the regular agenda as printed. Discussion. All in favor signify by saying aye.
Aye.
Against? Motion carried. So, I forgot, I think we're all set. We can go to non-agenda items and announcements. I forgot, is Jed on, Aaron?
Jed is with us.
Okay,
at least he was. Let's see here.
Jed, can you hear us?
Yep.
Okay, so I'm going to turn it over. We have a presentation on the status of COVID-19 in the city, but also this is from Jed Walt, who works for the Waupaca County Department of Health and Human Services. So we've been meeting with, set up by Aaron, of course, the department heads and myself have been meeting with Jed on a weekly basis, but we thought it was would be great for you guys to also hear what Jed has to say about what's going on with the COVID-19. So welcome, Jed. It's all yours.
Well, thanks. Thank you for having me. I'm happy to be here. As Mayor Smith mentioned, I'm Jed Bolt. I'm the health officer for Waupaca County. And I'd like to start out by just saying that, I appreciate the partnership that we've had with the city. And I really appreciate all the work that the city's put into all the things that have gone into this pandemic and all the things that everybody's had to sort through. But I think the city's done a really outstanding job of, putting in all the mitigation pieces and protocols, and really been a great partner in getting people together and helping with messaging. I really appreciated that. And then the weekly meetings that we have really been important, and in the communication and sharing of information is absolutely critical in these types of situations. And this has been obviously a long event. This is a pandemic. It's been ongoing since February and March, and it's been a long and trying and tiring experience. But everybody that within our community, within the county, within our municipalities, has really worked hard together to work our way through this. And I'm very appreciative of the partnerships that we've had, and particularly as well with the city of Waupaca. So I'll just start with a quick update of kind of where we're at. I guess for it's been a while, but I actually get to start with a little bit of a glimmer of good news with where we're at for our status. And I'm going to see if I can share my screen. I just have our dashboard up here, and let me see if it'll work. Aaron, am I able to share the dashboard or share my screen?
Unmute, Aaron.
Oh, there we go.
You're muted, Aaron.
Yeah. Unmute yourself there.
I'm sorry. Can you hear me now?
Yep.
Can you see my screen?
We can.
You got it.
Can you see my?
Yes, sir.
Yeah.
Yep.
So
Yes.
so here's this. This is our dashboard that's up on our website. You can check it every day. So we have our cumulative positive numbers. Those are confirmed cases. So we're up to over 3,700 cases. This is our active number. This is how many people are actively actively infected with COVID-19 right now. So they're in isolation and they're actively infected. We've had we've had 3,400 recovered, and this is a new number that we're starting to report as probable. This is a cumulative number, and we're going to start adding some more information around probable. Probable includes individuals that have been tested with an antigen test, which is a rapid test. And those are starting to become more available, and that's a number that we need to pay attention to as well, because it's not just our confirmed cases, which are the PCR tests, but also our probable tests. And then we have our negative, and we have 125 deaths, and I think that kind of speaks just to, how deadly this virus can be, and how we've definitely taken a hit in relation to deaths with this virus. 125 is a big number for our county, and percentage-wise, ratio-wise, we have one of the higher percentages in the state when it comes to deaths. And we went through some really choppy waters here in the last month, where we had a lot of fatalities. And most of the fatalities are older individuals. We've had a lot of folks in long-term care facilities that this has affected. All of our long-term care facilities in the county have gone through an outbreak. Some and most of them still have some active outbreaks. Some of them had gotten hit really hard, and now have started to come out on the other side of it where they have lower numbers. But that's definitely an area that we know that this virus can really affect. And our long-term care facilities have done a tremendous job. They've done a lot of work, everything possible, followed all the guidelines that they could, and it was just, we had so much community spread that it managed to get into long-term care, and that certainly affected our number of cases and affected our deaths as well. One thing I kind of want to show you now, I mentioned we do have maybe a little bit of good news, is we went through a really rough stretch, just like everybody else in the state, of a surge. These are our weekly numbers. And you can see we had basically a 7-week stretch where we had over 300, right about 300, and as high as 363 cases in a week. And these last 2 weeks, we've taken a step down. This is the first time after a sustained surge that we've taken a step down. 2 weeks ago, we had 175. This is a Sunday to Saturday total. And then this last week, 165. So a little bit of a glimmer of hope that maybe we're coming a little bit out of that surge. I think we need to see a few more weeks to see if it's something that is just a short period here and we're going to have a resurge, or if it's something that we can say, all right, we've kind of brought it down a little bit, and hopefully those numbers continue to go down. So I'm cautiously optimistic. We'll see how we come out of Thanksgiving and deer hunting and see if we see some surges from people getting together again, or if hopefully everybody kind of really took it serious and we're starting to see some downward trends. So cautiously optimistic, but certainly something we needed to see. Like I said, it was a 7-week stretch that it changed a lot of things for us. You go back to early or late September, late October, we had to change how we did our contact tracing. We no longer could trace contacts. We didn't have the resources to be able to contact people that were in direct contact with a positive individual. We had to just basically what's called crisis standards. All we could do was contact positive individuals, go over their healthcare needs, go over their isolation dates, answer questions. And we were doing that to the tune of 50 cases a day at some point in the last few weeks, which is a tremendous amount. It takes each interview, each time you call someone, it takes on average over an hour. So we were going through a really high volume of cases that we were contacting and working with our disease investigators. And we finally, like I said, we kind of maybe hit a little bit of a break here where we're seeing a little bit of light, where it's slowing down a little bit. That's good news. along with, we are getting closer to the vaccines becoming available. Actually, before I get to there, I'm going to show you one more graph here. This actually shows, this is active cases. So it's a combination of positive today, each graph in the red is a positive day, and then recovered total for each day. And then this chart is our active cases throughout the period. So our first case actually was March 26th, where we had one case. And then you can see the slow kind of development of the cases. And then it really started escalating in the summer. And then as we got to the beginning of September, and then October and November were certainly a surge there. And this you can kind of see the progress of how the volume of active cases that we had in a time period. And you can see now that we've had a pretty good drop here. So that kind of gives you a little illustration of what we've seen in countywide as far as activity with COVID-19. But back to the vaccine. So we are starting to get more information and starting to prepare more and more really every day now. We had weekly meetings for a while. Now we're getting to multiple meetings per week on preparing for the vaccine. Today, the CDC had a meeting on putting their recommendations for the 1A group, priority groups, which likely will include healthcare workers. Next week, the FDA will have potentially make a decision on the first virus to be approved for emergency use. That would be the I forget the first vaccine that's going to be available. Help me out, Aaron. Pfizer. Yep, Pfizer. So they'll make a decision on that hopefully next week. If it gets approved, within hours they'll start shipping and distributing the vaccine. And then it may be a week or two down the road when you'll actually get to vaccinations. So we're probably looking maybe towards the end of December before we start seeing the first group, phase 1A individuals get vaccine. How much everybody gets, it's going to be a limited supply to start out with. I don't know what Wisconsin's going to get, and then ultimately what Waupaca is going to get right now. So that's still yet to be determined, but hopefully those first vaccines are sound like they're going to be pretty close to being ready to go. And I think as we move forward, there's going to Moderna also has applied for FDA approval, so that second vaccine is maybe a couple of weeks behind, and then the third vaccine from the UK is also AstraZeneca is going to be making its way towards approval as well. So we're looking for some of those first priority groups, probably end of December, January, maybe start getting to some of the critical infrastructure groups, January, February, and then we start getting more vaccine available to the public and some of the public groups into February, March, April, early spring. And then I think hopefully we start really turning the corner once we have the combination of all the pieces that we have in place for mitigation, and then the vaccine. Testing also is going to continue to be a big part of that. Being able to actually have some of those rapid tests available and more testing opportunities available is going to be helpful too, because the faster we can identify someone who's positive and get them in isolation, that's how we slow down transmission. So we've seen more of that opportunity available lately too. Early on, we hardly had any testing available. You could get some limited testing at healthcare providers. Now we do have more community test sites available. We've had a weekly test site available with the National Guard at the fairgrounds for the past several weeks. DataCare has had some mobile sites in Waupaca County, in New London and Waupaca for the last several weeks. So that's actually been extremely helpful as well for us to help mitigate the virus. So that's kind of where we're at. Like I said, it's been a long road, and I think we're kind of halfway through it. I think the first half has probably been the hardest, and the second half hopefully will be a little bit easier. I think we're, like I mentioned, seeing a little bit of light coming through the tunnel here, maybe a little bit of slowdown in cases, and as I mentioned, the vaccine. So we're getting there. Definitely, we have to continue to be vigilant and continue to practice everything we've been doing and all the guidelines that everybody knows: social distancing, masking, hand washing. Those are continuing to be extremely important. We definitely do not want to get back to the level that we saw for 7 weeks. That was a really difficult stretch. You all know hospitalizations really surged throughout that surge in cases, and obviously the deaths did too. So I guess that's definitely a message I want to make sure we continue to provide is we have to remain vigilant on the things that we're doing and the guidelines that are available for us. We might start seeing some changes too on a few things. I know the CDC is working on potentially providing some other options for quarantine. So that may be something in the next few days we'll have some news on. As this has throughout it, things continue to rapidly develop and change, and that still hasn't changed. That continues to happen on a day-by-day basis. New information comes in. We're still learning about this virus. It's a novel virus, and as we've gone through this, we're getting more information and understanding it more. But there's still things we're learning about it too. So we're not there yet. We got a ways to go, but I think some better days are starting to look a little bit closer than they did a while ago, even just a few weeks ago. I guess I'll leave it at that. Maybe if you have some questions, I'll definitely be available to answer some questions.
Jed, thank you. So, council or staff, if you have some questions or comments of Jed, go ahead and speak up, but make sure you give your name first so that he knows who he's talking to.
I have one question, Mary Fair.
Go ahead, Mary.
So you mentioned the group A, the healthcare workers being vaccinated with priority, and then the critical infrastructure group. Who would comprise that group, Jed?
Well, that could include like EMS, law enforcement, some of those groups. That hasn't been determined. So the CDC will provide some recommendations on 1A and 1B and who that's going to encompass. And they're still going to have to define what healthcare providers means, who exactly that is. And so they'll provide recommendations, and the states ultimately make the decisions on how they're going to distribute and what the priorities are. But they're going to take the they're obviously going to have that as a consideration of what the CDC has recommended. But I think it's probably safe to say like healthcare providers are going to be in that first group, and then long-term care and some vulnerable populations are going to maybe be included in one of the 1A or 1B, and then like I said, maybe a group like EMS or some of the first responder groups.
Okay, thank you.
I have a question, Dimitri Martin.
Go ahead, Dimitri.
I got logged off, so forgive me if I missed something. Maybe you already covered this, but is there anything that you would like the city of Waupaca to be doing to help, prepare the community for, distributing the virus or the antivirus, or any other sort of tasks?
Well, I think a lot of what the city's been helpful with already, and I think it's going to be really important going forward too, is just continuing to help message things and make sure we're the information that we're able to provide as far as the status of things, and then things coming down the pike too. With the vaccine coming, I think it's going to be important that everybody feels comfortable and safe about that. So I think continuing the messaging that we all have been doing about safety practices, and then making sure that we're providing accurate information going forward about the status of the virus, the status of the pandemic, and some of the things, like I said, that are coming down the pipe.
Anybody else?
I don't have a
Jed.
question, Mayor, but I just want to
Yeah, go ahead.
mention a comment, and that's just, I mean, I think just everyone in council should know, and I know department heads do know, but I think the really most impressive thing and most appreciated thing from the city standpoint to the county and JED throughout this whole pandemic has been the response time. I mean, early on in this, everyone around the state and around the country was scratching their heads on quarantines and is this person a contact, a close contact, a probable contact? What are they? What's the next steps? And knowing how many people are tugging at JED's arms and JED's staff, they have. I mean, I get an answer back within that day every time throughout this whole 8 months or whatever it's been. So I just think people should know that. JED, thank you for that, and please thank your staff.
Thank you, Aaron. And I definitely want to mention our staff has done a phenomenal job throughout this. I've talked about it before. We've starting once we had our first case and then they started accumulating. We've been working 7 days a week, and we've got 4 public health nurses that have kind of carried a heavy load here, and then all of our other public health staff have adapted to take on a lot of COVID-19 work. Some of them have become contact tracers and disease investigators. And then we've hired another 10 additional LTE staff that have been tremendous. It's been, like I said, it's been a long road, and I definitely appreciate the staff that we have here at our public health department, and really proud of the work they've done. And I know they appreciate all the work that the city's done. They've worked with I think all of the departments. They've worked with the school district, and it's really been, like I said, a great partnership.
All right. Jed, thank you for stepping on with us tonight. I know this is outside of your regular work day, and so we appreciate that you were able to meet with us tonight.
No, thanks for having me again, and anytime you'd be interested in another update, I'd definitely be available.
Awesome. Thank you.
Thanks.
Let's move on then. Aaron, you want to just update the council on what's happening at the city level as far as COVID-19?
Yeah, let me just reshare my screen here. Hold on a sec. So I put a memo that you can see on your screen right now. It's in your packet on page 50. This word here should be December, not August. Thank you, Mr. Hackett, for pointing that out earlier today. So I just wanted to take this opportunity to give an update over the next month on kind of what we're planning on doing, the direction we're headed. We don't have another council meeting unless we're surprised here, until January. So really, City Hall, just a short summary of what we're doing: library, recreation, senior center, public works, police department, and the impacts that we've seen. So just to really briefly overview this, really there's just measures that will continue to be in place at City Hall, recreation center, police department, all of our facilities. All of our staff will continue their internal precautions, wearing masks. There's shields at customer service centers. Everything is virtual, or we're limiting numbers if we can. There's some different workstation setups. In crowded areas, there's been some remote work that has continued to be employed during this time. We will plan to continue to do all of that, even though the trends are heading in the right direction, which is positive. We also just had Thanksgiving. We had deer hunting. We have Christmas coming up, and it's just hard to predict what the impacts of those will be. So we're not planning to take our foot off the gas on some of the extra stuff that our staff has been doing for both customers and staff. Library has, they've kept you updated on all of the changes that they've made to be consistent with the OWLS network. The different types of services that are provided with browsing, and the different types of risks that some of that may present when we're talking about the virus. They will continue to do what they're doing. They'll continue to meet Monday afternoons as a management team after our department head team with JED and reevaluate their service levels at that point. There are capacity limits in place at the recreation center and senior center. You can just kind of see, I put examples of kind of what a program looks like right now, beginner and intermediate basketball. Andrew sent that to me, and just to give you an idea of what that looks like, since you're probably not going and checking it out. He's been in touch, and Cassandra's been in touch with the school district, athletic director, physical education classes, and they're kind of trying to align some of those things with that. And obviously he's been in touch with our healthcare or health professionals such as Jed. Public Works, they're inherently, it's a little better situation because a lot of times they're outdoors, but we've gotten comments over the last couple of weeks in which just the public has made comments that, hey, it's nice to see Public Works employees wearing masks in trucks when they're together in close proximity. So people pay attention to what we do all the time, and I credit our Public Works staff for being disciplined in what they're doing there. Police Department, same as City Hall, and then obviously extra measures when they're coming into contact with the public and all the things that they're dealing with. And then the impacts on staffing, we've been pretty lucky, and I think some of it's luck and some of it's a credit to our staff. And we have had some situations in which we've had COVID-19 cases. We've had close contacts, but we haven't had outbreaks at work. And as far as we know, we haven't even had a scenario in which someone's contacted it in our facility from being at work. So I think that speaks, it's been challenging, and even when one or two people are out, it can seem frustrating for our department heads and supervisors. But all in all, when you look back at the big picture of how the last few months have gone, it's been pretty positive. We haven't had any real dire scenarios in which we've needed to really tone down services or anything like that because of it. So we've been able to keep services as we have. And then I just have a little outlook on state emergency orders. There's a lot of talk about what's going to happen with the emergency orders and Governor Evers. And we've reached out to people, done our own little research, reached out to the League of Wisconsin Municipalities. And the reality is no one really knows until something gets announced. And I can tell you throughout this whole time period, I've had businesses contact me and say, hey, where do you think we're headed with this or that? And I've said, we're not expecting any communication from Madison or the state. And then I'm not kidding you. It seems like every time I have that conversation with a business owner, we do get like that night, within 24 hours, there's communication. So no one seems to know when it's coming or what direction it's going to go until we hear it, which is okay. And we've worked through it when we've gotten those. So I can't really tell you exactly what it looks like is going to happen with some of the challenges with the mask order. I can tell you, it will continue to be staff's recommendation to continue to push through our community media, through whatever promotional channels we have, to follow CDC guidelines, Waupaca County health guidelines, work with our partners at Theta Care that are professionals, to continue to get people to act accordingly, to help mitigate the spread while that vaccine has not yet been distributed. So that's just a little outlook. Nothing really new. I think you guys have been probably in the loop on all of this throughout the time, but just because we're not meeting over the next month and over the holidays, I wanted just to take a chance or the opportunity to talk about it.
Awesome.
Thank you.
Aaron.
Yeah, thank you guys.
Anybody have any questions or comments for Aaron besides Mary's just comment there? All right, let's move on to public input. Aaron or Sandy, have we received anybody that would like to give public input for tonight?
I have not.
Here.
All right, thanks. We'll move on then. Let's go to unfinished business. And before I turn this over to the council president, Paul Mayo, for my recommendations, Aaron, so the first three are basically just filling voids that are on those committees or commissions or boards that we have. But then the fourth one that has to do with the CDA. Aaron, you want to just touch on that, why we're doing this again here?
Yeah, absolutely. So the CDA, and you've heard us talk about this as well, we are looking to use the Community Development Authority to help administer this downtown business incentive program. They'll be reviewing the applications and then be reviewing the proposals and the presentations from the applicants or building owners. We hope to have that be kind of their focus over the next year, but then move it along into our other economic development goals and help be a steering committee for that. Now, when we went, we've had a CDA for years. I want to say back to the 80s. Don't quote me on that, but it's been close to that long. And when I went back to look at it, we matched it up with state statutes, and the people we had appointed to it didn't meet the state statute requirements. So we kind of just had to reshuffle the deck with everything and reach out to those people. We had some non-residents, some staff members that maybe didn't exactly meet those state statutes. And I think the reason we had that is because really it hasn't been an active group since I think the last meeting was 2013, and it was kind of an administrative meeting in nature. And then before that, I'm not sure when the last meeting was. So this was just an opportunity to meet state statutes, get the right people in place. And I can tell you that a lot of these people or all of them are excited to be a part of that effort with the Downtown Business Incentive Program. And we look forward to working with them on other things.
Thanks, Aaron. So I know at the annual meeting in April that we appointed a number of people to the CDA, and you'll see that we are actually changing the names that are on there. So I'm sorry for those of you that have been appointed to that CDA that we are putting people in place of you on there. But just understand that by doing this reappointment, then you will no longer be on the CDA.
And so, just to piggyback off that, just so everyone's clear, I know we did have too many elected officials on there per the state statute, so that's just one thing to keep in mind.
Right. Thanks, Aaron. I just thought that needed to be explained.
Yep.
Paul Mayo, it's all up to you.
Thank you, Mayor. Can you hear me?
Yes.
Okay, good. The mayor appoints the following people to these various commissions, boards, and authorities. City Plan Commission, Angela Lesage. Board of Appeals, Jerry Duman, Lentry Vance. Parks and Rec Board, Megan Waller. Reappointment to Community Development Authority, Mayor Brian Smith, Jean Lesage, Shelody Udoni Horn, Pam Gusmer, Denise Ross, Tracy Barrett, Paul Mayo. At this time, I need a motion to approve the mayor's appointments.
So moved. Second, Lori.
I believe motion is made by Steve Hackett, a second by Lori.
Yes.
Okay. All those in favor say aye.
Aye.
Opposed, no.
Keelan abstains.
Okay. Alan abstains?
Correct.
All right. The mayor's appointments are approved. Back to you, Mayor.
Paul, thank you. Appreciate that. All right, let's then move on to new business. We have a request from the Waupaca Area Convention and Visitors Bureau for their 2021 Strawberry Fest site proposal and street closure request. Obviously, we didn't have one in 2020, but in 2021, that has to change because of the Main Street project that's going on. So, Terry, appreciate all the information that we got in the packet, but I'll turn it over to either you or Mitch. I'm not sure which one of you two are.
Actually, Mayor, I'm going to take over
Okay,
on that.
Mitch, this is Mitch Swenson, everybody.
So yeah, with the construction plan for Main Street, we were brainstorming ideas on where to relocate for 2021. Optimistically looking forward to having the event, and of course, lots of things can change, but we still need to move forward on the planning process. And so we met with Administrator Jensen, the Chief of Police, and the administrator from Trinity Lutheran Church, and are looking at utilizing the property east of our new chamber facility and the streets around Trinity Lutheran Church and their parking lot. And with this plan, we reached out to all of the property owners that are affected, and they're lettered there on that map. We sent certified return receipt letters with all this information. We got return receipts back from everyone, and we asked for any concerns. And the primary concerns that we received, there was basically being able to get in and out of their driveway, which with the type of through traffic closure we're proposing, we would allow them in and out, obviously, to their properties. We have gone through to make sure that there's emergency access to all properties for fire, ambulance, that type of thing. The one concern was from a property owner, and that's property C. There's a bad section of sidewalk along that property, and there was concern if they would be liable if somebody attending Strawberry Fest would trip and get hurt on that. We explained that we do carry event liability insurance. Also addressed this with Aaron Jensen, and he talked to the streets department, and they plan to fix that section of sidewalk prior to the event. So we would also provide that property owner with a letter of insurance from a certificate of insurance from our insurance company. So I guess, first of all, while that map is up, does anybody have any questions on kind of the layout we're looking at?
Mitch, maybe we could just highlight that the blue areas are the only parts on the street. Just on Jefferson Street, that one blue area would be the only place that we would have vendors in the street. Otherwise, all of the streets would be clear of any type of event things. Everything would be taking place on the Trinity Church parking lot or in the parking lot of the chamber building.
Correct, yeah. And the other thing, Chief Hozell suggested that we would give the property owners bright colored placard to put in their windshield of their vehicle so that we know that they're coming and going to their home properties and such. Those were really the only concerns. We had a lot of positive concerns, or positive comments, I should say, about keeping the event going, and some property owners even suggesting if there's anything that they could do with their property to make the event happen, they would be happy to do so. The other thing we're trying to do is keep the event as close to downtown as possible. And with this layout, we're in close proximity to the rec center where the model railroad show happens during that event, and again, as close to the downtown district as possible, in hopes of still driving traffic into the businesses downtown. So I guess with that Aaron, if you can just scroll up one page. This is our request to the city council, and that would be closing Jefferson Street from Badger Street to Deer Street for traffic, closure of the entire length of Deer Street for through traffic, closure of Division Street from Badger Street to Deer Street for through traffic, necessary barricades and signage support from the City of Waupaca Street Department, and we would request that we could have those closures in place effective on Friday, June 18th, 2021 at 5 p.m. until 6 p.m. Saturday of the event. So that is our request.
Thank you, Mitch. So you can see that it's changed from the normal down around City Square and on North Main Street, and you can see that the chamber has put in quite a bit of effort to make sure that the city, as well as the residents and the local residents that live around that area, have been informed. And I do appreciate. I've had a couple of individuals that have had some concerns, and I know that Mitch has talked to those individuals, and although they might not be satisfied, he gave the explanation to them. So I think it's a good option. Quite honestly, we wanted to keep and I think the chamber did too, wanted to keep the Strawberry Fest near the downtown area versus some of the other areas that they were talking about. So hopefully we can get this thing going again this next year, and then back in 2022 we'll be back to what we call normal. So what we would need then from council members is to approve of this street closures for the Strawberry Fest.
Move to approve, Lori.
Second, Martin.
So we have a motion by Lori Chestnut, second by Dimitri Martin, that we approve of the 2021 Strawberry Fest site proposal and street closures request. Any discussion? All in favor signify by saying aye.
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 Against? Motion carried. Mitch, thanks for getting on tonight. Terry, you also, and explaining what's going on.
Thank you, Mayor.
Thank you very much.
Let's hope for a great 2021.
Yeah, I agree. Let's move on then to the adoption of the Parks and Rec Department Comprehensive Outdoor Recreation Plan, or the CORP plan. And Andrew, I'll turn it over to you here.
All right, thank you, Mayor, council members. I believe I'm sharing my screen at this point for you. You are. Just take a look at a few things. So I'll go over a brief overview of this, and definitely let me know if there's any questions or comments. One change that was brought up already before I start by Mr. Keelan was that Lori Chestnut's name is not spelled correctly. So we will make sure that we get that changed and spelled correctly on this document. So this comprehensive outdoor rec plan has been a year-long process facilitated by Trish Now of the East Central Planning. She had another meeting tonight and was not able to attend, but she has been very invested in this as we've gone through this process. This has involved both public input and direction from our park board members throughout this whole year. The updated plan will allow us to seek grants and other funding opportunities over the next 5 years. And that's really why organizations need to do this. Grants such as stewardship grants or DNR funding, they need to see that it's in the CORP plan for the things that you're going after. The core plan includes 6 different components. It starts with the tangible goals and objectives for the planning. There's an inventory of the current parks and green space that we have. There's needs assessment of future improvements, health assessment of the existing facilities, some recommendations and public input and public opinion. And then at the end, you end up with a 5-year action program to guide us into 2025. So I'll just go through each of those sections real quick and show you where they would be and kind of what they look like. So the first was the goals and objectives. This was the goals, the SWOT analysis, and the objectives were based on conversations by Park Board. So Park Board had a lot to do with what you would see here and the next couple pages with those goals. Many of them, if you read through them, are just centered on meeting the needs of all the people in our community, and a lot on collaboration between the city, the townships, the school district, and I should add the county as well, as we've been working with them through this COVID pandemic that we currently are in. Then the next step would be that current inventory of our parks, which would be on page 37 here. And what that does is it just shows us what we have, and this is all based on our current population or our population estimate. And so that takes into, the standards that are set of how many of each of these you would have per your population. We fit very well into a lot of these, and so we looked really good as far as our current inventory moving forward. And well, that leads us into our needs assessment. So our needs assessment shows us that we're really in more of a, maintaining and enhancing the current structures we have and making sure we're taking care of those and improving them as needed. So that's really what came from that needs assessment based on the current inventory that we have. Like I said earlier, a lot of this had to do with, public's opportunity to share their opinions and their votes and their recommendations. So in this document, you'll find that in 2 different places. We did 2 different things. One was an online survey that was finished by 340 participants, which is a really good number for the amount of people that we have in this area. So we were very pleased. You can see in this very tiny map on here that there were people. Let's see if I can zoom in on that a little bit. There were people mostly from the area, but you can see there was people from outside the area too that had come here and wanted to have their opinions put into this as well. So that was part of it. And we also did some boards at City Hall and the rec center. It was kind of a place your dots or place your stones on the different things, and you could vote based on that. So all the information is in here. But at the end of this, you can also see the full results in Appendix A. Starts on page 81. So all the different questions that were asked, all the different answers, and all the different comments that were down there as well. So read through all those, looked through all those, and there's some really good stuff, and also some things that we could improve on. So based off of all that information, we ended up with, let me get to the right page here, some general recommendations, and this goes through each park, okay, and breaks them down. There's community parks, there's mini parks, and just gives us kind of a general priority and recommendation for each of those. Some of those overall, some of the main focal points of those priorities and recommendations were expansion of bicycle and hiking trails, so those multimodal trails, and creating a comprehensive bike and ped plan, creating intriguing spaces for sitting and enjoying nature, accessible and safe water play for the community, such as a splash pad or a water structure, or of course pool came up a couple times as well. Upgrades to the restrooms, increase in silent sports by creating access points throughout the park system, and then adding more activities for teens and youth. So those are some of the high points and a lot of what the priorities and recommendations were. So after all that, you end up with a really good document that will be very helpful to me and my staff, very black and white, and that's a 5-year action plan. And so what it does is it kind of breaks it down into different sections. So improvements in parks, we have, excuse me, that first one, it was actually improvements for all parks and trails. Then it breaks it down to each park. It kind of states where it came from. Okay, was it from the audit? Was it from the survey? Was it from the recommendations or from the park board? And then kind of prioritizes it. So very black and white, easy document for us to follow as we go through the next 5 years. And I really like that about this document. I wanted to thank Park Board, of course, for all the work they put in, and Trish. And it's been a really interesting and you know, I learned a lot from the process over the last year. So with that, and that one change to Lori Chestnut's name, I would like to request council approve adoption of the court plan as written.
This is Lori. Move to approve, and thank you.
Keelan, second.
Motion by Lori Chestnut, second by Alan Keelan, that we approve of the Parks and Recreation Department Comprehensive Outdoor Recreation Plan, or better known as the court plan. Any discussion? You know, this is really good, Andrew. Obviously you guys went through a lot of effort, but I think it really hits on a lot of things, or almost everything, that you know, and looks at the good things and the bad things that need to be updated or not updated in the city. So I think it will be a nice plan for you moving forward. I like it.
Definitely. Thank you.
All right. This requires a roll call vote, so I'll have Sandy take the roll.
Steve Hackett.
Aye.
Lori Chestnut.
Aye.
Paul Hagan.
Aye.
Alan Keeland.
Aye.
Scott Perchatsky.
Aye.
Dave Peterson.
Aye.
Paul Mayo.
Aye.
Dimitri Martin.
Aye.
Mary Fair.
Aye.
And Eric Olson.
Aye.
10 ayes, motion carried.
Awesome. Well, thanks, Andrew. And it looks like you have another item yet.
Yep. So next on the list, we have a recommendation from the Senior Center Advisory Board. So at the last Senior Center Advisory Board meeting, I believe it was November 10th, they had a good discussion about the possibility of lowering the age of eligibility from 55 to 50 for the Senior Center. After that discussion, they agreed that they would like to recommend this change for the center, and that's why we're bringing it to council today. So the AARP really sets the standard with the eligibility of what's considered, or what we consider, a senior with an age of 50 years old. And there are many other senior centers in our area that are also set at 50. I'll talk a little bit on this, but Sarah Raybrock is our senior center coordinator. She's also on tonight in case there's any questions, and she'll talk a little bit on it as well. So I forgot to mention that. Sorry, Sarah. The mission of the senior center is to provide older adult opportunities for continued independence to maintain an active, productive, and dignified life. So that's the overall mission of the senior center. Part of this is assisting individuals with health needs such as bone density, fall prevention, cognitive function, and mental health. The consensus is that if we offer these programs to younger seniors, we could potentially, look at decreasing the chances of these incidences happening. So this change may also increase membership, which would help add in revenue as well. So, Sarah, do you have anything to add from your memo here?
We're just looking at the consideration of this because we do have some couples where we had, when we did our veterans, free veterans, we had a couple come in, the husband was 55, the wife was 50, and they wanted to participate together, but she wouldn't have qualified. And we've had that happen a couple times between couples. So we just thought this was a good opportunity to talk about it in our marketing strategy going forward too. of breaking down the stereotypes associated with senior centers too. So we thought this was a good way to kind of implement that right now.
Thank you, Sarah. And so I guess with that, we'd like to request that council approves this change of changing the minimum age of eligibility in the Waupaca Senior Center from 55 years old to 50 years old.
Okay, we'd be looking for a motion to approve this change.
Olson to approve.
Second, Fair.
Motion by Eric Olson, second by Mary Fair, that the council approves decreasing the minimum age at the senior center from 55 to 50. Any discussion? Well, that means we got some super seniors even on the city council right now if we're down to 50 for seniors.
Well, I don't know. I qualified, so I kind of.
there you go, Paul.
Treading water here. We're treading water.
Come on down.
All right, you ready to vote? All in favor signify by saying aye.
Aye.
Aye. Aye. Aye.
Against? Motion carried. Andrew and Sarah, thank you.
Thank you.
Thank you, Mayor.
All right, Aaron, you're up. This has to do with our ambulance service agreement. Take us through it.
All right. Thank you, Mayor Smith. So this is something we've briefly touched on in our, or maybe not so brief, in our budget committee of the whole meeting earlier in November. This year we have seen some negative impacts of the pandemic as it relates to the cost to the consortium that Gold Cross provides services to. As mentioned in my memo on page 58 that you can see on your screen, really the things that's driving the rate up on a per capita rate is the lower usage. People during the pandemic were nervous or anxious or just kind of worried about getting in an ambulance, taking it to the hospital, worried about going to a hospital in general. What impact that had was that insurance revenues from ridership really went down. Gold Cross covered those losses in 2020 through their general fund balance, but as they plan for 2021, they're not expecting, obviously, as the calendar year turns back, to have it be right back to normal ridership rates. So they're trying to budget on that 4% margin that they always budget on, and budgeting at that 4% margin with the trends that they have has it jumping from $10.32 per capita to $15.33 per capita for 2021. You know, we could look at this as something that we expect to be a one-year hike, at least to that level of $15.33. What the new normal is for ridership, I don't think anyone could tell you that for sure, but I can tell you that in conversations with Mark Fredrickson, who, Mayor, actually, Mark has joined this in case there are any questions. He joined halfway through the meeting. I think he had a church council meeting. You know, we don't know what that's going to be, but we certainly expect it to go down. And in the effort to know what those trends are through 2021, we've kind of reached out to Mark and requested quarterly meetings in which maybe we can jump on a Zoom call or something for, 30 minutes, invite everyone in the consortium, see where we're at in 2021 and what that means, where we've been and what that means moving forward. And if the year stopped right then, what would that per capita rate be in 2022? Mark and his staff have agreed to do that, and he's even said, hey, I'd be happy to meet with you monthly to look at those trends moving forward. This is something we have budgeted for. Kathy was able to budget the $29,378 increase in our budget. So that was set in there. And I think the only other important thing that maybe I didn't really get into in my memo to say, how else would we meet that increase, or how else would we attack this kind of challenge that we have? And it's the only other option probably is decreasing an ambulance, which we don't think is an option. And I think that in the people we've talked to and the people that have been in the consortium, I don't think anyone thinks that's an option. We don't want to, that's not a service we feel, especially during these times, that we should be decreasing. This second page that you see on your screen now, subsidy per capita, this shows the history of Gold Cross and what our rates have been since 2015. You know, history tells you a lot, and they've decreased on that, sticking to that 4% margin. They've decreased every year since 2015, which is why, you know, I can say that's I would expect it to move back in that direction once we get back to some sense of normal. And then this is just a comparative to some other kind of rural communities in our area, what they're paying on a per capita rate for ambulance service. So I'll stop talking, and I guess our recommendation would be to approve the 2021 ambulance service agreement with Gold Cross Ambulance Service, Inc. And if anyone has any questions for me or Mark, either of us would be happy to answer.
All right. We're looking for a motion to approve this, understanding that the budget you're going to be looking at tonight has these numbers already in there. So anybody like to make a motion?
I'll make a motion that we approve this.
Keelan, second.
Motion by Steve Hackett, second by Alan Keelan, that the council enters into a 2021 ambulance service agreement with Gold Cross as presented. Any discussion?
Mayor?
Yeah, go ahead, Lori.
Okay, I just wanted to be reassured one more time that this is just for the 2021 budget and not moving forward every year?
Yes, Lori, this is a one-year agreement just for 2021. We'll talk about a 2022 agreement next fall.
Okay, thank you.
Yeah, so just to add a little bit to that, although nobody likes to see amounts go up, I think Mark and his staff have done a credible job of indicating and showing us why those numbers are going to be different for 2021. So I feel comfortable that he is going to be able to show in the future what those numbers will look like in the future too. So I hopefully things do change as far as the COVID is concerned. I think this is one of those few times where, you know, less is not better. You know, people are using the ambulance less, and now we're paying more. But we can see why that's happening.
Mayor, I like the idea also of monitoring it. But whether it's 3 months or 1 month, I think that's a good idea. We can track and see if we do trend downward again. Thank you. All
right. Thanks, Dave. Yeah, and I mean, obviously you can see on the page that Aaron has in front of you that we're still getting a pretty darn good deal even at that dollar amount. And that would be true for our other participants, which are the 4 surrounding townships too, have that same, because they're in with us, of course. Good. All right, ready to vote? Sandy will call the roll.
Steve Hackett.
Aye.
Lori Chestnut.
Aye.
Paul Hagan.
Aye.
Alan Keeland.
Aye.
Scott Perchatsky.
Aye.
Dave Peterson.
Aye.
Paul Mayo.
Aye.
Dimitri Martin.
Aye.
Mary Fair.
Aye.
And Eric Olson.
Aye.
10 ayes, motion carried.
Right. Thanks, Aaron, for putting together that memo. It was helpful. And Mark, I'm sorry I didn't know that you were on the meeting tonight, but thanks for just stepping in.
Well, thank you, Mayor. I appreciate it. Thank you, Council, as well.
All right, let's move on then. We have resolution number 1472. This has to do with our budget for 2021 and doing the tax levy. So I'm going to turn it back to Aaron. Are there things you want to touch on, or do we just turn it right over to Kathy?
No, I think we can turn it over to Kathy. I think she's got it well outlined in her points here, and if there's anything afterwards, I'll be happy to chime in. So.
All right. Yeah, me too. So, Kathy, if you're ready, go ahead.
Okay. Again, just to reiterate from the public hearing and the meeting before, the items on my cover memo are what's in the general fund and what's driving a lot of the costs this year. And the review of the final tax rate is that our levy only increased 33,710 for our net new construction of 1.5%. There is no increase in the debt service levy, even with the issue that we just did. The TIF increment increase is 121, which is 121,000, which is the city's share of the increase is 54,000, and that's due to the $7 million increase in TID values. Specifically, most of the value is in TID 8, which is good. The tax levy increase due to the $6.2 million decrease in assessed value, which gives, again, a smaller base to spread the tax levy over, which is 70 cents per thousand of assessed value, or 2.83% over last year's net tax rate. The total levy increase with all tax jurisdictions is 135,000 approximately, and 1.3% over last year. So right in keeping with inflation. Reduction in the state school levy credit was 57,000, and there were reductions if it applied to properties with first dollar credits and lottery credit amounts. Next page, Aaron. Again, our levy, total levy, is the general fund is $1,706,104. The transit fund stays the same at $10,000. We are moving additional $23,250 to the airport fund so that it remains solvent. And the youth program fund is staying the same at $102,323, and the library fund is just being adjusted for $7,000 that was different from 2020's budget for $346,554. Our debt service fund levy is staying the same, as we're using fund balance to make up the difference in the amount we need for debt service, and that stays at $70,334. Sorry. The total tax levy is $3.3 million. Next page. This was in the paper. It's been on the website. It's been posted in 4 places around the city. This is all of the information that we have to provide to show transparency to the taxpayers of where 2018, 19, our estimated year end for 2020, and our comparison budget to budget. Also, all of the special revenue funds, debt service and capital improvement funds, and the TIF funds are provided with the change in their balances. Next. Again, a change in the tax rate. This pretty much shows, again, the change in our assessed value and each of the taxing jurisdictions for the tax levy. And so so the resolution is to adopt the tax levy back, Aaron, to the resolution. 2 pages. There you go. There's the resolution to adopt a tax levy of $3,318,265. That's all I have.
All right, Kathy, thank you. Anybody have any questions of Kathy or comments you would like to make?
Yeah, Mayor, Scott has a question.
Yeah, Scott, go ahead.
Kathy, could you explain or give us an idea how maybe we could recoup or reestablish that $6 million in assessed value going forward? Or is there any way we can get some of that back on a tax roll, some of that money, so we don't have as big a bump as we did this year?
Well, the part of the change in the value is manufacturing is assessed by the state, and that fluctuates from year to year. We go back a couple years, like I think last year we had an increase of $9 million in value, but the year before we lost $7 million. So it's the fluctuation in the manufacturing assessment that's done by the state that we have no control over. The other one would be is to get something into the Kmart building that definitely lost value, being a dark store, that it affected this year's assessed value. The other thing would be is looking forward is to get a revaluation done of the properties. We have 3 years. Once we are below 90% of equalized value to assessed value, that ratio that's out there, that we need to have our properties reassessed and back to 100% of market value. What that does is make everybody back on the same playing field and make sure that everybody's paying their fair share. That's the only thing, unless you can, find somebody to drop another $6 million investment in the city and have it on the tax roll by January 1st. Okay. That right. Would be the only way that you would be able to recoup that $6 million.
Okay, thanks.
Yeah, thanks, Kathy. I think it's fairly well known that the biggest drop in that amount is coming from our number one employer in town, who requested from the state a reduction in their assessed value of the property, and that's something that we have total no control over whatsoever. Now, the Kmart building, we did have some control over that, but they did come forward to the tell me what board that is again. The Board of
Review.
Board of Review, and they requested that their value be reduced. And of course, being a dark store, we did reduce it, not as much as they wanted to, but we did reduce it some there. So yeah, those are tough things to get. But we've seen a lot of good stuff happening in our community, not only with some expansion in manufacturing, but also residential too. So I think we'll make up a lot of that in what we see in 2021.
The Swiderski property probably won't hit next year's tax bills, but it'll hit the 2022 tax bill. It'll be effective as of January 22. That will come into play. Also, when we close the TIF districts, as we start doing that, that'll also bring in some more adjustments in the tax values.
All right. I can't remember. Did somebody make a motion?
Yes, Mayor.
No, but I will. This is Keeland. I
Okay.
so moved.
Lori,
Motion.
second.
Motion by Alan Keelan, second by Lori Chestnut to approve resolution number 1472. This is a resolution designating appropriations and levying a tax for the 2021 budget for the city of Waupaca. Somebody, was that you, Paul Hagan, that, or no? Who was that wanted to say something? Nobody? Okay. All right, let's go ahead and Sandy, take the roll.
Aye. Lori Chestnut.
Aye.
Paul Hagan.
Aye.
Alan Keeland.
Aye.
Scott Kwiatkowski.
Aye.
Dave Peterson.
Aye.
Paul Mayo.
Aye.
Dimitri Martin.
Aye.
Mary Fair.
Aye.
And Eric Olson.
Aye.
10 ayes, motion carried.
All right, Kathy, thank you on that. Although you're not done yet, you have another resolution you want to discuss with us.
Yes, the next resolution that I have is to change over the long-term disability insurance program over to the state. We need a resolution to come under the income continuation insurance plan under employee trust funds. And I have a copy of the resolution and the application that we will have it effective as of April 1st. We do have coverage for the employees with the current provider until that time. So it's still going to be a cost savings for the city as long as the state has a premium holiday for this insurance.
All right. So again, Kathy would be looking for a motion to approve resolution number 1473.
This is Mary. I'll make that motion.
Second.
Who is that? Steve Hackett?
Yes.
Okay. Motion by Mary Fair, second by Steve Hackett, that the council approves resolution number 1473. This is inclusion under the income continuation insurance plan. Any discussion?
Alan, is your hand up on purpose? Sorry, or is that an accident?
No, I hit the wrong key. Sorry.
Okay, sounds good. Thanks.
All right. Any other discussion? Sandy will call the roll.
Aye.
Lori Chestnut.
Aye.
Paul Hagan.
Aye.
Alan Keeland.
Aye.
Scott Kwiatkowski.
Aye.
Dave Peterson.
Aye.
Paul Mayo.
Aye.
Dimitri Martin.
Aye.
Mary Fair.
Aye.
And Eric Olson.
Aye.
10 ayes, motion carried.
All right, Kathy, thank you. Next up, we have the license report 1520, which is for taxi cab drivers. We got one person on there. We'd be looking for a motion to approve.
Move to approve, Lori.
Olson, second.
Motion by Lori Chestnut, second by Eric Olson, that we approve license report 1520. Discussion. All in favor signify by saying aye.
Aye.
Aye. Aye.
Against? Motion carried. All right, just a couple of quick items under the communications and recommendations of the mayor. One is that obviously remember that we're not having a second meeting in December unless we find it that it's necessary, but normally we know by now whether we have to have a special meeting or a council meeting. So it would really have to be something that we can avoid. So we won't have another meeting till January, which brings us to a new year in the plan, and that could change as we go through the month of December and look at what's going on around us. But the plan for the first meeting in January is to meet in the council chambers, and we'll stay on that same direction and see what we can do to make that work. Even if we do decide to work, and people that might feel uncomfortable with meeting in council chambers, we plan on for the future, we plan on offering the ability to anybody to meet remotely if they choose to do that, until we're not allowed to do that anymore. But so plan that in the future, and I think our board meetings and commissions will probably follow suit too in January, unless we see something that changes drastically in the meantime. Also want to wish everybody a Merry Christmas. Obviously, it's only December 1st, and we're wishing a Merry Christmas, but this might be the last time we see each other before that time. So hopefully you have a good December and a very good Christmas.
Thank you.
Yeah, and of course, go Packers. And we'd be looking for a motion to adjourn.
Move to adjourn.
Keelan, second.
Motion by Hagan, second by Keelan, that we adjourn till our next regular scheduled meeting, which is going to be Tuesday, January 5th, 2020, subject to call. All in favor signify by saying aye.
Aye.
Against? Motion carried. We're adjourned at 7:36 p.m. Drive safe, everybody. Have a great night.